Well, hello, everybody, and welcome to the show. My very special guest today is Dr. Nicholas Nelson, and he is in Edmonton in Alberta. Welcome, Nicholas.
Thank you very much. I'm happy to be here. Appreciate you reaching out, and yeah, lucky and excited to be chatting here with you.
Okay, so this is in the evening of Thanksgiving up here in Canada, and we're both working a little bit. So it's all for the benefit of you, our audience, because our hearts are really out there to help you guys. So let's just go back to the beginning a little bit, Nicholas. I know you're from Edmonton and you work there. So just take us through what led you to this point in your career.
Yeah, so I'm from Edmonton. Truthfully, when I was in school growing up, I was not a school kid. I kind of hated it. I skipped a lot of classes and barely graduated. I truthfully was the last person anyone would have foreseen becoming a doctor of any sort. However, after school, I was an athlete. I was very much into fitness. So not knowing what I wanted to do for a career, I went to work at a gym and I pursued personal training. And I became a personal trainer at a local large gym for about 5 years. During that time, I realized that there was a lot that I knew and that I was good at, but there was a lot that I didn't know about the human body. So I actually began the pursuit of looking for, secondary education and going back to university. So I went back to school a little later than most. Anyone in my grade that would have went back to school was already there and gone at that point. So I was kind of a lone wolf in school, but that's okay. I don't mind that. So I originally went back to school actually to become a chiropractor. While I was there, I fell in love with pretty much everything in terms of the human condition. So I pursued a lot of neurology and psychology. I also pursued avenues of philosophy and anthropology that just kind of took my interest and I started running with them. So I knew I wanted to do something to do with healthcare and medicine. I was actually pushing towards the allopathic medicine once I started my undergrad. But about halfway through my undergraduate career, my mom got sick with cancer. And we spent about 3 years, just under 3 years in the hospital back and forth with her. And it was not a great experience, to be honest. There was a lot of places in which I felt like she was failed, a lot of things that really I did not sit well and truthfully, I think led to the detriment of her. And I decided then that I never wanted to work in a hospital setting. And I wanted to essentially find a different lens to look at the human body, which led me back towards the chiropractic route. However, when I was at that point, I still really thought a chiropractor was going to be working with athletes all the time. And that was really what I was thinking my career was going to be until I got to grad school and I realized that the entire chiropractic profession is based on neurology and based on how the brain communicates with the body. And it actually was a really interesting full circle with everything I'd studied and I enjoyed in my undergrad degree that I wanted to pursue in an allopathic setting. I actually have the chance to pursue it now in a hands-on chiropractic setting.
Okay, so you've been qualified for about 3 years now in active practice there up in the north.
Yep.
So what exactly are your treatment modalities that you're using for clients right now?
So I stick very much with chiropractic treatment in my clinic. So I am not a multidisciplinary clinic. Not that I in any way do not enjoy working with other practitioners, mostly because all of the most successful and most powerful chiropractic clinics that I've ever known and studied, and the professors and doctors that I got to work through and meet, were all strict chiropractic offices. This keeps our intent and our purpose and our vision very clear. And we treat the body through chiropractic adjustments, whether they be gentle or traditional manual therapy adjustments. But we don't really stray outside of those paradigms.
Sure. Okay, so you got the high velocity thrusts, which is the classic, chiropractic manipulation, and the soft tissue work as well. Do you work on the soft tissues?
In a small degree, I do some forms of active release and just some very gentle soft tissue work. However, again, I consider myself a vitalistic practice, which is a little bit different from a lot of the chiropractors in the Canadian side of the world. So we're very specific in our terminology. We're very specific about calling things adjustments instead of manipulations. And we look at the way in which we are adjusting the body is a very specific direction in a very specific way to correct a very specific vertebral subluxation. So we use a lot more imaging and a lot more analysis than many other chiropractic clinics. And I find in my own perspective, just from the way I was taught in California for my chiropractic school, the more you muddy the waters with many different modalities and the more you try and be good at everything, the less you become great at something. So I would much rather be phenomenal at what I do. And if there's another application needed for my patient, then have a network of individuals I can refer them to who are phenomenal at what they do.
So can you explain to me, because I'm unsure the difference between, you go into your chiropractor, you get you assessment, you get a manipulation, you come back maybe the next week, you maybe come back for a few visits, problem goes away, and if you're lucky, and then you move on. But that's not what you're describing. You're saying an assessment with specific x-rays. So just to describe that for us.
Yeah, so there's two very drastically opposed way of looking at treating somebody chiropractically. Now, many of the treatments in the, I guess, pain-based model really focus on treating somebody's symptoms in their area of complaint, doing an assessment that is usually a very general assessment over that area based on palpation techniques and heat thermography and things like that, and doing a manipulation to the area to essentially relieve pressure to the area and in the hopes that it will reduce the pain. That is not the model that I practice and not the model that I was taught. So we are taught a vitalistic model in which pain is just a very small facet of the things that we're treating. But pain for us is it's a check engine light, but it doesn't mean that the problem is the light going on. The problem is something else that caused the light to go on. So we look at pain as just a facet of overall global health. And we use the chiropractic adjustment to very strategically use imaging. So we're taught very, very well and very highly trained on x-rays specifically, but all imaging modalities. So if there's MRIs needed or available, if there's CT scans, anything like that, and also x-rays, we use an x-ray to look at the actual shape of that individual spine and be able to tell the areas of stress in that spine based on osteophyte formation, degeneration, things like that, that are very obvious and very measurable. And even if they're not feeling pain in that area, we can see physiologically that there is stress in that area, which is going to be causing some dysregulation somewhere. So we treat the system based on what we can find in these screening techniques using x-rays and using the palpation and everything as well with that. But we adjust the individual hoping to have overall health improvement instead of just pain improvement.
So can you just give me an example, like maybe a patient comes in on a neck pain, say, and maybe referred up to the head, and then you'll do the x-ray and you see like a C5-6 osteophyte, which is just an overgrowth of bone, right? So are you thinking that is, does that tell you something other than it's arthritis, it's wear and tear in that level, what the traditional doc would say?
Yeah, absolutely. Arthritis, you don't get arthritis just because you get old. You get arthritis because the stress on a segment of that body has been irregular and improper for a prolonged period of time, long enough that there's an actual physiological response in the bone. So when the stress on a vertebral segment or any other joint is actually changed and increased, you actually have a changing to the electrons of the area and you have a change to the electromagnetic flow. This is the piezoelectric effect. In that area, you have a positive spin into all of those areas, and you actually get osteoblasts, which are designed to build bone. They come down and they start laying down tissue in an attempt to stabilize the unstable or irregular stressed area. So when we see an osteophyte formation in a joint, whether that person has pain or not, we can tell 100% for sure that the stress on that area is irregular and not appropriate, and especially in regards to the other areas that do not have osteophyte formation.
Okay, brilliant. This is the first time I've heard somebody use that term, and I've used it in my education of fascial pain and the formation of tightness and thickness and then inflammation and maybe even tiny crystals based on the piezoelectric force or
Mhm.
charge across the tissue. So this fascinates me. So, okay, let's go back to the case. C5, 6, middle of the neck, you get an osteophyte, you got this electrical field thing going on. So what do you
Mhm.
do to fix that? Can you just give us an example just to get us inside this idea?
Yeah, so the osteophyte would be present based on likely an irregularity to the formation of that segment in regards to what's above and below it. So if the cervical spine is supposed to sit with a concave like this, and right at that C5, C6, you have a change to that curve, then
Right,
you have a change to the stress regulation of that area. So
right.
we use X-rays to not only be able to see things that we can't, and I mean, you probably know this, you can't feel an osteophyte. You can't feel dysregulation in actual vertebral segments. You have to see them. So we use the X-rays to actually measure the degree in which that joint is fixated or subluxated outside of its normal positioning. And we look at the angle in which it should be moved to restore appropriate motion, and we adjust it in that direct, exact alignment. So this is the big difference between taking somebody and just seeing, oh, you have a tight neck, and just doing a manual manipulation versus taking somebody, assessing their actual structural, segmental, skeletal factors, and then adjusting that segment in a very specific manner.
Wow. Okay. So I'm understanding this a little bit better. The X-rays, are they standard X-rays or are they magnified views or different views, say an oblique view or other things?
Yes, views would be very needed for if we're looking for a neurological symptom. So every single X-ray is going to be based on what we're trying to assess. If somebody has radiculopathy going down their hand, and we're looking at a C5 dermatome, then we're going to get an oblique view to be able to see that intervertebral foramina where that nerve comes out. But if we're looking at global, somebody has just problems with migraines and they have very, very tight muscles and they have things like that in the upper neck, then we're looking more, the main X-rays that I would send for would be an anterior to posterior view, a lateral view, and then an anterior to posterior open mouth view, in which we would open the jaw and be able to see the C1, C2 intersection there, which is a hugely important area for things like vertebral vertigo, in terms of headaches, problems with vision can happen through these areas. So depending on the symptoms that they're experiencing, then we send for different X-rays.
And do you arrange for alternative scans as well, like CTs or MRIs?
If need be, yeah. It's not often that we have to send for a huge an MRI or anything, and we know in Canada that it is very difficult to get into unless the individual is willing to pay privately. But CT scans and MRIs have been things that we have sent for. Most often, the way that those present to my clinic is when an individual with a complex neurological case that they haven't felt relief from anywhere else, they come to my clinic and they bring all of these imaging with them, and I read and I interpret that to them in ways that they usually haven't actually ever seen their X-rays or had an interpretation or their MRIs. So I take that all into account when we're addressing the individual if they're already present or if they need to be sent for.
And what's your success rate?
Pretty high. I mean, I don't have an exact ratio, but I do tend to have a very good outcome with most people. I do tend to get a lot of the complex cases, like we were just talking about, that, quite often I hear I've been to 5 neurologists and nothing's working. And those are realistically my favorite because those are the people that really need your help, right? And going back to my reason why with all of this, my reason why was my mom. So every single person that walks through my door, whether they're male, female, older, younger, to me, they're my family. And it's my goal to help them to the absolute best I can. And, we're sometimes not everything's perfect and not everything works 100% of the time. But I don't think I've ever had somebody leave here not thinking that I did absolutely everything I could.
Wow. It makes a lot of sense to me, when I think of chiropractic adjustments, and I've had, quite a few over the years, but I've never really been one of those guys that keeps going every week. I don't really believe in that, but I love the scientific specific diagnoses from an X-ray. And I think you're the first person to really explain that to me in that way. So I'm relieved. So well
Well,
done.
I appreciate that. It's a little truthfully disheartening and sad for me because
Yeah.
I often hear that. And that is one of the biggest problems I would say in plaguing my profession, is that the
Mm.
science of what made chiropractic so powerful is being lost. And the philosophy's already been thrown out the window by 90% of the schools. So you have basically two schools left teaching the philosophy, let alone the actual science behind it. So it's a very well researched paradigm. It's just not talked about that much.
So let's go back then. You talked about neurology. So can you explain where the adjustment, you're putting the spine hopefully to the correct position, or maybe subsequent visits, to the correct position. What is going on with the neurology, the nerve connections that involved with these tissues, from the brain down to, say, the soft tissues, because it passes through this section that you're talking about in the bones?
Yeah, absolutely. So there's a few different ways in which it impacts the neurology. The most extreme and classic version is if a vertebra is moved out of its normal position to such a high degree that it actually causes a physical compression on that nerve. This is where you have radiculopathy and neurological symptoms down dermatomal patterns. So we use areas of the hand or the feet that are numb or that are in pain, and we can actually trace those back based on the pattern in which it's showing and presenting itself up to the vertebral segment that's likely a problem. So the classic version that everyone thinks about is bone pressing on nerve. And this is great, and this is something that happens often. However, the more common avenue of this is going back to the piezoelectric effect. If you have a shifting of that vertebral segment outside of its normal position, even though you do not have a physical compression of that area, you do have heightened inflammation, which does start to cause a compression of that area. But outside of that, nerve conductivity is based on electrical conductivity. So if you have a change to the conductivity of the tissues around that area based on change to the piezoelectric effect and change to the nerve conductance of inflammatory cells, then you can actually have a diminishing impulse down to that extremity or organ or wherever that nerve tends to go. So those are two main areas of the direct neurology. Third area is going back to what you were discussing about the fascia. We actually have a system called Biotensegrity throughout the entire body, where if you have a shift to any of the segments of the body, not just the vertebral segments, but if you have a shift to the knee or a shift to the ankle, it's like taking a bed sheet that's like a military tucked in bed sheet, and you just crinkle one corner, it's going to raise from every corner, right? So what you can see with this is if you have distortions to the physical frame, you can actually have effects at vastly different areas of the body based on that biotensegrity. So there's a check that we do, or I do with everyone that's in here, called the cervical syndrome check, where when they're laying on the table, I have them turn their head side to side, and you can see that sometimes the leg raises if they have a fixation in the cervical spine that's causing a change to the fascial all the way down to that leg. So we can see that things like that, outside of just the neurology of the direct nerve pathway, it has an effect of neurology based on your physical awareness of where you are in space, and also the way your actual physical spectrum moves. If you're doing a deadlift and you turn your head to the left and you have a cervical syndrome, you may drop your hips outside of their normal alignment and put yourself at risk. So there's avenues like that it actually affects the neurology in a little bit more subtle ways. But the first two are the main ones that chiropractic is known for, I guess.
This is your host, Wayne Phimister. Thanks for enjoying the show today. Today, I'm advertising my Healing Chronic Pain course. Now, it covers the new science of how your brain can heal pain. It covers the heart-brain connection, as well as the gut-brain connection. Also, I dive into inflammation, how you can heal that, and optimize movement as you move towards a new reality in your body. So check it out on the link below. Enjoy the show. And if you're fixing the first two, you're putting the joint back, are you finding that the fascial response through your exam gets better too?
Oh, yeah. Yeah. There's always a post check. So after the adjustment, there is a change to all of those orthopedic tests that we saw leading up to it. So we can see cervical syndrome cleared out immediately after an adjustment.
Yeah, that's completely fascinating. I'll tell you my story. 5 years ago, I was doing IMS or dry needling, taught by Chan Gun here in BC. And I was doing it for, since 2003, in fact, 2002. And when I moved to medical needles, I found that I could hear a grinding sound in the fascial tissue in the muscles. So as I was putting these medical needles in, a little bit of lidocaine, I could hear this grinding sound. And I thought, oh, what's this? I didn't know, right? I had no idea. So I was talking to my patients, they're the ones who educate me. And as I go forward here to discover this, and sure enough, the hunters of my group of patients were saying, yeah, when you cut up a moose, you got multiple knives. Why? Because the sinew blunts the knife. So here we are, these patients with chronic pain, they've got this tightened fascial tissue, and I was releasing it. And as a result, blunting the needle, I would change the needle, and then the noise would simply go away. So that was my aha moment, because 25 years ago, I had chronic chest pain as a 20-year-old. And nothing was diagnosed with it. I didn't know what it was, tried several modalities. And then I got 10 sessions of rolfing, which is a deep tissue, soft tissue massage. And lo and behold, it went away.
Yeah.
Wow, fascia. So here I was 25 years later, coming across this in my career, thinking, right, fascia is absolutely everywhere, because as it goes around tissues, it goes through muscle, around muscle, connects muscle to muscle, it goes around your organs, it's the ligaments, the tendons. It's literally the strong structural tissue within our bodies, dynamic, flexible, amazing thing. And we completely forget about it in medical circles and traditional medical, right?
Yeah. Yeah. There's unfortunately quite a few, I like to call them purposeful blind spots, because the amount of information and research out there to show that they exist is pretty substantial. But fascia is a massive blind spot. And the other biggest blind spot that I encounter on a daily basis is the blind spot to structural integrity of the body actually having an effect on the function of the body, Yeah.
Exactly. It's such an important area, and there's no tests for it diagnostically. You can pick it up because you know what you're looking for, and you can get the connection. But other than that, the medical doctors, unless you're a surgeon cutting through things to get to a joint, usually, tendons to fix them, you're not thinking about this layer. But this layer is fundamental to our structure and our pain, our presentation of pain.
Absolutely. Yeah.
That's quite amazing.
And just another thing to know is that fascial tension and muscle tension is set by your neurology, right? And that is another area that unfortunately I don't find there is enough really understanding. And even certain things like dry needling and rolfing, sometimes there's mass amounts of scar tissue that absolutely need to be removed because those are binding the area together. However, if there's a constant treatment of a tight muscle, because that muscle is always tight, a muscle is only tight for usually one of two main reasons. Either it's carrying a load that's too heavy for it, or one of its two attachment points is shifted outside of its normal placement. So treating something symptomatically because it's constantly tight is basically getting mad at the individual that's carrying more load than it should and forcing it to stop carrying the load, even though somebody else around it has to pick up that load while you shut off that muscle. And neurologically, it's going to turn itself back on until you fix the problem.
Fascinating. I find over the years that if the patients are not getting better with what I do, just releasing the fascial tissue, then the inflammatory response kicks in to a point where it doesn't go away. It doesn't go away. And therefore, they're just so resistant. So that's when I could see that your treatments would be, well, your product treatments are very effective from the beginning, but the more complex they get, the ones that you've talking about, and they're probably, most of them are complex by the time you get them. There must be an element of inflammatory response as well, which is just, it's like glue in those tissues, just keeping it all stuck together, pulling those joints, pulling those tendons, and putting them out of place.
Yeah, absolutely. And inflammation has kind of got a bad rap because inflammation is actually the way in which our body heals naturally, right? The problem is chronic inflammation, in which the body cannot appropriately clear out whatever the condition is causing the inflammation, which then instead of the inflammatory cells sending signals to the brain and telling it what's going on and telling the brain how to handle that situation, they become basically chickens with their head cut off, running around back and forth, increasing inflammation. Cellular decay from the inflammatory cells causes increased pollution to those cells around it. And you just have this positive feedback loop. And that's another thing in which an adjustment and other modalities that can move fluids through the body are very important, because you can actually have releasing of chronic cycles inside of the area due to just simply changing the connectivity of that area to the brain for a short time.
Now, I was just talking with my mentor at the weekend here about this, because I've been doing a second technique called hydroneedling or hydro TPI, and we inject a solution of saline and lidocaine, quite a lot of it, with a touch of depomedrone, just a little bit of methylprednisolone and that cortisone. It's like a 40th of the dose of a traditional knee injection for, say, arthritis. And I put it in there and I irrigate and I wash out these tissues, and then I detoxify, as you said, pollution. So detoxify, removing those inflammatory cells into the lymphatics, into the blood circulation, and then through the kidneys, and we urinate them out. And it's a technique that he developed himself over the last 20 years. He's been doing 40 years of nurse and anesthetic practice in Omaha, in Nebraska. And he figured this stuff out, and he's been training some people on this in his state. But I kind of met him on the podcast show, actually, and then we were talking about it, and I thought, I know what you're doing. That's amazing. So he taught me, and we did it through FaceTime because it was COVID. I'm pretty adept with needles. I've been doing it for 20 years or so. So, and now I've got this technique that literally deals with the chronic inflammatory cells, and it's a one-of-a-kind treatment. So I'm so blessed to be able to do this, but then understand what this piezoelectric, I love the work of you must have been taught this at your chiropractic school, but the work of Becker, Robert Becker in the day, the orthopedic surgeon, and I think in the 60s was doing this research on growth of salamander limbs and all this stuff, showing the piezoelectric effect and the growth of these limbs, which you think, oh, that's not possible. But yeah, that's what he proved, but that's what the initial science came from. So it's
that is the foundational book in that field for sure.
Right, Robert Becker. Yeah, it's amazing. So it's so great to actually talk with somebody that knows what this is. And from your chiropractic perspective, doing your thing, and then from my perspective, I'm doing from the soft tissues, and a combination of it is maybe where the answer is.
I mean, the thing is yes, we're coming from totally different modalities, but we're talking the same language because we're seeing through the same lens, right? You said at the beginning of this that you somewhat ventured away from the traditional lens of the allopathic, and I think that this is an important thing in which both of our treatments are trying to work with the actual natural processes of the body instead of trying to hijack them and overrule them. And that is the biggest thing that I think, as a global society, need to look at for healthcare, is that we need to stop thinking that we can overrule the mechanisms and the functions of the body. And we add something in one place and we know we're taking it from somewhere else, but we're trying to pretend that we're not. And we have to realize that there are natural processes and laws that we have to follow. And if we can use modalities that honor those, I think that's where true health is going to come from.
I completely agree. Absolutely. Yeah, and I think we kid ourselves if we really think that we know what's going on with this amazing being of 30 trillion cells, with 1,200 chemical reactions every second in every cell. Like that's just a number bigger than we can think. But that's all working together, and it doesn't even work if we've got no energy, as in no spirit, no,
exactly.
Like, how the hell does this work? And it ain't, based on the scan that you see, and it ain't based on, the stuff that we're taught 20 years ago. No. There's a miraculous thing happening all the time. And it's so important that we just focus on, well, what is actually going on? And just, as you said, respect it, follow it. Where's it out of alignment? Fix that, fix the next thing. But just go with it, right? And I'm sure it's your experience that when you do it, the body just goes, okay, I know what you're doing. And it just fixes itself, right?
Well, exactly. And that is part of chiropractic philosophy, is that we are aware that we are not healing anyone. We are actually removing interference, and the body is healing itself. So your body is a self-regulating system, and there is a force that animates all things at all time and gives it its own intelligent creation. And just like we don't have to tell our bodies how to heal from a cut, when it cuts itself, as long as we make sure that it's not infection, there's nothing interfering with it, it will naturally heal. And yeah, I think you're right, is that we have fooled ourselves to think that, not only to think that we know how the body's working already, but to think that we can actually do it better than the body. And that is a big mistake.
Oh yeah, absolutely. Okay, well, listen, this has been a great chat. Any final comments?
Yeah, not particularly. I'm happy to have, this show going on and you being able to bring other modalities to light. I'm grateful to be here. So yeah, I'm just happy to have this experience.
Well, tell us then, okay, how can people, if people are in the, Edmonton area, how can they get a hold of you?
Yeah, so if you're in the Edmonton area, I have a clinic that I own and operate just off of White Avenue. It's called Element Chiropractic. You can look it up online. The website is elementchiro.ca. Outside of that, even if you're not in Edmonton, I do have a YouTube channel in which it's just called Element Chiropractic. I have Instagram as well. You can check me out at element_chiro. And the other thing is that I am in the process of writing a book. So there will be an expansion on the principles that we talked about here. So if anyone wants to reach out and chat more about all of these things, including yourself, I would love to go into any questions that anyone has.
Perfect. And the school, so people maybe say in the US who are like, well, I want to get a chiropractor like yourself in my area. What are you looking for in the sort of reviews for these chiropractors?
So one huge thing is, if you go to a chiropractor's website and they don't use the term adjust and they use the term manipulate, then you'll know that they are coming from a different branch of schooling. So we are considered what's called either vitalistic or principled chiropractors. Those would be the two terms to search for. Secondary to that, if you wanted to reach out to me directly, and even send me an email anywhere from whoever's listening at elementchiro.yeg@gmail.com. We have a network of individuals that I graduated with. I went to school in California at Life Chiropractic College West, which is probably the best and most principled school left. But we have a network of hundreds of doctors around the world that we're all still in contact with, and we always search out principled chiropractors for patients in need.
Mm-hmm. Well, listen, thank you. Such an enlightening chat today, and I wish you all the best in your career.
Happy Thanksgiving. Thanks for having me.
Yeah, happy Thanksgiving.
Take care.